Merhaba, Ben Julia Ross. I'm the author of 3 books, 2 of them specifically on the use of neuronutrition to eliminate cravings for drug-like foods. I've been directing outpatient treatment programs in California since 1980 for the treatment of addictions and eating disorders. I've also been training and certifying health professionals for 25 years. Our own obesity epidemic was announced here in the US in 2000. Like you, my staff of psychotherapists and nutritionists tried many things, tried very hard, but all of it failed to halt the epidemic as we saw it building after the 1970s. We now know that the foods produced by the US snack food industry, starting in the 1970s, were intentionally designed to be highly addictive. The involuntary overconsumption of these foods has since created the greatest US and worldwide public health crisis of all time. We were fortunate, though, in the United States in the mid-'80s, as we were seeing how unsuccessful our treatment tools were, that the new field of neuroscience was starting to publish its discoveries, and the neuroscientists who specialized in the study of the brain and addiction were starting to speak to us directly in the addiction and eating disorders field. They understood why our treatments were failing, and they were able to explain it to us and give us information about what the real causes of these addictions were. The training that I'll be giving you in November and December will start by providing you with an understanding of this neurobiology of food addiction, the very same things that we learned about in the 80s. Then I'll share my experience of how we use simple nutritional techniques that we learned from these same neuroscientists to correct the malfunctioning neurobiology. The 4 key appetite and mood regulating neurotransmitters that we will be targeting in the training are serotonin, our natural antidepressant, endorphin, our natural opiate, GABA, our natural tranquilizer, and norepinephrine, our natural stimulator. At this point, and for many years now, 90% of my virtual clinic's food addicted and mostly obese clients have been freed of all cravings for toxic foods. And they've been enabled to eat a healthful diet. All of this within 24 hours. This then frees them to return to their genetically intended and ideal weights. I'm very much looking forward to joining forces with you to beat back this global epidemic, and I'm honored to have been invited.